With One Detroit. Tonight we have a special presentation for you, a live 1-hour town hall with our U.S. Senators from Michigan, Senator Debbie Stabenow and Senator Gary Peters. They'll be talking about the COVID-19 crisis, how it's impacting Michigan, and the federal response. This is a joint effort between all of the local broadcasters to try to get out as much information as possible. And make sure you stay with Detroit Public Television for daily updates and interviews. You can find those at onedetroitpbs.org and across our social media platforms. Thanks, and be well.
A typical April sees Michiganders ready to burst into the sunshine. But April 2020 brings us eerily empty streets and parks and waterfronts that feel abandoned. But that strange quiet remains at odds with the frantic pace that remains inside many hospitals. And for the healthcare workers putting their own lives on the line every day to save the lives of others.
I'll continue to do.
As expected, Michigan's governor extended her stay-at-home order. Public health experts agree, but others wonder if the small business owners devastated by this crisis will ever recover. And those seeking unemployment help from the government too many times hear this.
Your call cannot be completed as the called party is temporarily unavailable.
Questions remain. Even if it's accessed, is the help enough? Is the federal government targeting the help in the right places? And if the curve is flattening, how do we begin to emerge from the long, dark night of COVID-19? Tonight, we renew the team efforts of Fox 2 News, 7 Action News, and Local 4 for a conversation with Michigan's 2 senators, Debbie Stabenow and Gary Peters. Across the state of Michigan, it's the live Senators Town Hall.
Good evening and welcome to tonight's Town Hall. This is the second in a unique partnership of which I know we are all proud to be taking part. I'm Carolyn Clifford from 7 Action News, along with my colleagues and partners, Hill Perkins of Fox 2 News and Devin Skillian of Local 4 News. Hill and Devin, it is certainly a great pleasure to be with you again tonight. I know we have all received a lot of questions from viewers all over Michigan.
Well, we sure did, Carolyn, and we are delighted to have with us this evening Michigan's 2 members of the United States Senate, Senator Debbie Stabenow and Senator Gary Peters. We live in times that are quite politically charged. There is no getting around the fact that we are joined by 2 Democrats this evening, but that is the tandem that Michigan voters have dispatched to Washington. And our goal tonight is, frankly, to steer clear of politics. Huell.
We're going to try, Devin. The goal is to give Michiganders the information they want on the federal response to this unprecedented crisis, a crisis that has taken so many lives. As of today, we have lost more than 2,000 Michiganders to COVID-19, and sadly, they won't be the last. In addition, so many other people have lost their jobs, their income, their faith in the future, all of us wondering what's ahead. With us now live from their homes, Senator Stabenow in Lansing and Senator Peters in Bloomfield Township. So let's get started. Now, this is a question for both of you, beginning with Senator Stabenow. You just heard the president outline his plans to reopen parts of the country in phases. What's your reaction?
Well, Hugh, I've seen a little bit. I want to see more of this now. What I've heard is that he talked about testing, which is so important, and about the governors making their own decisions within their states. What I would say is to re-emphasize what you just said. We've lost over 2,000 people in Michigan, moms and dads and grandpas and grandmas and friends and neighbors, and we have to make whatever decisions are made as a country and as a state based on the medical experts to keep ourselves safe. We all want to get the economy going again. We didn't want it to stop. We don't want it to stop. But we've got to focus on the medical experts and the testing. And I will finally say that, you know, eventually a vaccine is going to give us all the confidence to be able to go back and live our lives and have the vaccination and continue with what we've been doing in our lives. But between now and then, it's about testing. We need to have the kind of testing where, just as the mayor of Detroit has been able to do with a 15-minute Abbott test for police officers, you take the test in the morning, you get the results immediately, you know you're okay, and then you can go to work. And so I've been very involved in that. There's a report on my website. I released a report yesterday about where we are in the United States compared to the world, where we need to go, what we need to do. So I'm hopeful that the President and others that will all work together. We have Republican colleagues now that are talking about testing as well. This is about working together to get people back to work. And I would just close by saying that my favorite T-shirt is it's everybody against COVID-19. And I think that's the way we have to look at this.
Senator Peters, the goal is to ease restrictions in areas where there are few infections, but to hold the line in places that are hardest hit. What do you think? Will it work?
Well, I think we have to be very careful about moving forward. Certainly, we all want to get back to a normal. I'd say it'd probably be a new normal. It's going to take some time for us to gradually reopen. But I believe it's absolutely essential that we do this from expert advice from epidemiologists and our public health experts that can tell us the way to move forward, but to do it in a fashion that protects people. And we know that this disease is very, very contagious, and it can spread very, very rapidly. And one thing that we have known is that it's really critical to make sure that you stay ahead of it, which is why having some very strict restrictions right now is just so important, that people stay at home and take only those most necessary trips out so we can slow down the progress of COVID-19. It's critical for us to make sure that we have hospital capacity, that this disease doesn't get ahead of us, and then folks are forced into the hospital. And if the hospitals run out of beds and run out of ventilators and run out of the ability to treat the ill, you're going to see death rates increase dramatically. But having said that, I think when you do monitor it and you look at whether or not you're actually flattening that curve, and when you're doing that and you believe that you have sufficient hospital capacity, should there be a resurgence, you can start slowly but surely opening up businesses. Now, you're going to have to do a variety of things. I agree with Senator Stabenow that testing is absolutely critical. You have to know who is sick and who is not sick. That's one of the problems we have right now is we simply did not have that kind of testing, robust testing, early this year. Other countries were able to do much more robust testing. Those countries that did that are in a better situation now than we are. Some of them are starting to move towards opening up their economies. But there's also a cautionary note. Some of those countries like Singapore and Hong Kong that had success doing that are now starting to open up some of their businesses, and they're seeing some resurgence. So this is a very delicate line and a very delicate balance that we have to move forward. And in addition to testing, though, you have to make sure we have personal protection equipment. I'm sure we're going to talk more about that here tonight. We still don't have enough personal protection equipment for people. We're still struggling here in Michigan to get that equipment for our medical personnel. I'm the ranking member on the Senate Homeland Security Committee. I oversee FEMA. I'm on the telephone every single day to someone from FEMA, including the director, to make sure that we're getting those critical supplies. And we're going to have to ramp those up as well as we go. And we're going to have strict social distancing. And I think you're going to see businesses that are going to be limited as to how many people may be in that business. Or if at some point restaurants open up, there'll be limits there as well. But it's going to take constant monitoring. It's going to be a very delicate balance. And it has to be driven by public safety and the expert advice we get from those folks from the public health area.
All right, thank you both. Carolyn.
All right, Senators, thank you so much for being here tonight. This question is for both of you. Now, thanks to a $2 trillion stimulus package, people have started getting their checks. They're like, thank goodness for that. But many of our viewers wanted to ask both of you, why did you initially vote against the stimulus package when so many people are in desperate need right now? And are we going to see a second round of stimulus money? Senator Stabenow, let's start with you.
Absolutely. Well, first, I would say that the entire process from start to finish in the Senate took only 5 days to do this huge, over $2 trillion package. And the first vote that Senator McConnell decided to do was to do a vote before we had the bipartisan support to get this done. And the original bill that he put forward did not in any way have the health care money that we needed. It didn't even come close to addressing what our doctors and nurses and hospitals need and what we need to be able to get the testing and the vaccines. And so from my standpoint, I knew we could do better, and we did do better. At the end of this, it took just a couple more days to be able to address what is number one, the healthcare pandemic, and then secondly, while people are being asked to stay at home or required to stay at home or required to close their businesses, we have to have a way for people to have income, which is the other piece of this, from unemployment to small business help to the $1,200 checks and the things that come together to try and help with what is a very difficult time when people are being asked to stay home and do their part. So that's the reason I didn't support the original plan. It wasn't good for Michigan. It wasn't good for us. The second thing, though, is we will have another package. We're in the process of negotiating that right now. We need more dollars for the small business package. We need more healthcare dollars. Right now, again, it's a healthcare pandemic. If we're going to go back to work, if we're going to be safe, and our families are going to be safe and confident, and people will, workers will feel confident going back to work, we have to get our arms around this healthcare pandemic. And we also, I believe, have to make it very clear that for the doctors and nurses and everybody on the front lines, that we are not only grateful, but that we are giving them what they need. And part of what we're making as a priority for this next round is something that Senator Peters and I have both been involved in, and he may want to speak more to this, but the idea of hazard pay, something called a Heroes Fund, because for the doctors and nurses and mail carriers and grocery store clerks and people working in law enforcement and the delivery people and so on, it's wonderful to say thank you, it's wonderful to say prayers, but we need to make them whole financially for themselves and their families. And that's a big priority for us in this next round.
Thank you so much, Senator Stabenow. Senator Peters, do you want to weigh in or do you want to talk about that Heroes Fund?
Well, I'd love to, because I think that's critically important as we move to additional aid. I think we all knew when we passed the CARES Act, it was a substantial piece of legislation providing over $2 trillion in aid to our hospitals, to working families, to small businesses. But we also knew that we would have to do more. And we wanted to step back, kind of get a sense of where we are, and then find those kinds of gaps, and then fill those gaps with additional support. But one area that I feel very passionate about are the men and women who are truly our heroes. These are the folks on the front line that have to go to work every day. You know, so many of us can be at home, shelter in place, work from our kitchen tables, be online, are able to continue our business that way. But many folks can't do that. They have to show up to work in order to get a paycheck. And we also, that job is absolutely essential for our economy as well. And just think of those necessary jobs. Certainly we think of our health professionals. We need our doctors and nurses and medical techs. But we also need the custodians in those hospitals. We need the janitors. If they are not there cleaning the hospital, making sure it's sterilized, it would be very difficult for that hospital to operate. And think of folks that are working in our grocery stores. For us to have the ability to stay home, we need to be able to go to a grocery store in order to get food, in order to live. And yet they're there, they're stocking the shelves, they're doing the work, they're interfacing with the public, and they're putting themselves and their families at risk. And you can just go down the list of those kinds of jobs. The transit driver, bus driver, for taking people to work. If you look at folks working in pharmacies, or government employees like our postal workers, to me, these folks deserve more than our thanks. They do deserve hazard pay. So we have a proposal that we're going to work to try to get into this next package that says if you're in one of those necessary jobs and you're interfacing with the public and putting yourself and your family at risk, you should be entitled to additional pay. And we're looking at paying $13 an hour over and above what the individual may be making in their regular job, getting $13 extra, capped at $25,000, starting from when this pandemic started to the end of the year. And I just simply think it's the right thing to do, to not only thank those individuals who are putting themselves in harm's way in a necessary, critical job, but also to make sure they get compensated for it.
Yes, indeed. Heroes, indeed. They deserve every penny. Thank you, Senator Peters. Devin, I'm going to send it over to you.
All right, Carolyn. Senators, one of the most frequently asked questions that I've had coming in have actually come in the last couple of hours today. I've heard from a number of small business owners just today who believe it is unconscionable that the Senate failed today to refill the payroll protection stimulus coffers. They ran out of money today. Now, I realize, Senator Stabenow, I'll start with you. I realize this gets close to political, so I'd move into this trepidatiously. But the people that I'm hearing from have not mentioned politics at all in their emails, only that they're about to lose employees because the Senate failed to come through.
Well, Devin, it's a really important question. I'm glad that you ask it, because this is a really important program. It's a strong bipartisan program. We put $350 billion into this. And as with anything that moves quickly, we knew that there would be some glitches. And so we've heard from independent restaurant owners that have not been able to access the fund, people in rural areas, our farmers who have had trouble because they use farm credit and it wasn't originally recognized as part of the banking system for the loans. We have those in our neighborhoods and minority business owners who are what they call underbanked, not connected to a big bank. So we need to get this next round of funding, absolutely. I want to make sure that also every kind of business, whether you're rural or small neighborhood mom and pop operation, downtown in one of our small towns in a microbrewery or a bakery or a restaurant or coffee shop, we've got a few things to fix. It can be done very quickly, and I'm confident that we'll be able to get that done. But we want to make sure everybody in Michigan is being supported with this.
All right, Senator Stabenow, I want to stay on stimulus as we go to Senator Peters. A different version of the question, though, talking about the different approaches that we're taking. It's interesting. The United States has decided to approach this from filling up the unemployment side of this, from creating a more robust unemployment program. Other countries, notably a couple of in Europe, have decided that they were giving the money instead to businesses under the promise that they would keep their employees on the job. They're trying to freeze their economies in place so that they can simply then restart the economy. Our approach is going to mean meaning rehiring, getting people reacquainted and reinstalled with their benefits. I'm wondering if we're doing this the right way.
Well, there are different approaches. You're right, Devin, about that. And I think part of the approach that we're taking is that we use existing structures so we could move this as quickly as possible to make sure that people could get money. For example, the unemployment insurance, as you mentioned, we rely on that a great deal, and it's a system that's in place, and it can move money very quickly. Right now, of course, those systems are overloaded, but relatively speaking, it was already a framework and a system in place that we could start making sure people could get money as quickly as possible. You know, I know that many folks who suddenly found themselves unemployed as a result of this crisis were in serious financial trouble. Most families live paycheck to paycheck, and if you miss that first paycheck, you're in serious financial trouble. Yeah. We wanted to get money to folks as quickly as possible in order to do that. And so the unemployment system and the Pandemic Assistance Act, which is actually modeled from what I wrote, my legislation, which expands eligibility in unemployment beyond just the traditional folks that normally get unemployment. So you have small business owners that can file for unemployment. You have folks in the gig economy, independent contractors, people who wouldn't normally get unemployment, but certainly needed a paycheck as quickly as possible. It's a model we use for natural disasters. My work in Homeland Security and overseeing FEMA, when the hurricane comes in, people find themselves unemployed. The unemployment system can step up fairly quickly to get money into people's pockets because they're suddenly unemployed. So that happens when we have hurricanes. Now we have a hurricane sweeping the whole country, and that's why this the unemployment system is so important. And that's why we also made sure that in addition to whatever the state pays, there's an additional payment of $600 per week provided to folks, and that'll run through July. So that's a key part. And as far as the question about bringing people back into business, it's a very important aspect as we restart it, which is why we also have the Paycheck Protection Plan with the Small Business Administration that you were just talking about. that we have to keep our small businesses in business. You can't restart an economy very quickly if we find that our small businesses are suddenly out of business. They're the engine of growth. They're the folks that employ most of the people in the country. So we also needed to protect them. And that's why we used the 7A loan through the Small Business Association or Administration. It's something that has already been used. It was already an existing framework. We just put more money into it, $350 billion. And we also thought that if you had local banks, community banks, credit unions, those folks actually processing applications, you'd be able to get it into the hands of small businesses a whole lot quicker than trying to set up a new system. Yeah. So the answer to your question, Devin, is these are two existing systems. They may not be perfect to be able to ramp up to the volume that we're dealing right now, but they were already existing, and we thought we could get money in the hands of people a whole lot quicker.
They have been overwhelmed thus far. We'll see if they can catch up. Let's go to Huel now.
Devin, thank you. This pandemic is not only killing people, it's also putting the financial health of many hospitals in jeopardy. DMC is about to furlough 480 workers. McLaren is cutting the hours of its doctors and nurses. Beaumont is temporarily shutting down its Wayne Hospital and laying off 300. Now, these workers tell me, if you're willing to bail out Boeing, what are you going to do for them and for the health care system that's in trouble right now? Starting with Senator Peters.
Well, there's no question we need to provide additional assistance for hospitals. In the CARES Act, we provided roughly $150 billion to support our healthcare providers. I'm on the phone regularly with providers and have been talking to administrators over these last few weeks. And we are facing a crisis with our healthcare system, a financial crisis that they're very concerned about. And they should be, given the fact that they're now moving away from the normal kinds of procedures that they do in these hospitals that pay a lot of the bills and really transitioning into dealing with COVID-19. That puts them in a precarious financial situation, and it really makes it dangerous for them when they come out of it as to whether or not they're going to survive. We do need to put more money in. I think as we're dealing with additional legislation to help small businesses, we're going to have to make sure small businesses have more money in this next version, and I fully support that. We've got to do everything we can to make sure our small businesses are healthy, but we also have to make sure that our health care providers and our hospitals have the resources they need, not to just get through this crisis, but to be able to emerge from this crisis stronger and healthy. And I'm afraid right now, the way the money is being provided, it's not enough. And I'm also really concerned about our rural hospitals. Our rural hospitals are going to be in a particularly difficult situation. They don't have the resources that some of the more urban, suburban hospitals have. They're really right on the edge, and they can easily fall off that edge without additional resources from the federal government. So I think that's critical. We're talking about how important it is to get money into the hands of small businesses as quickly as possible. We have to add to that list our hospitals and health facilities to make sure that they get through this and on the other side can continue to provide the kind of health care that we need in our state.
Senator Stabenow, in the same vein, it's frightening to think that we are laying off health care workers at a time when this pandemic is ravaging the state.
I know. You look at it and you go, wow, this doesn't make sense, right? And what we have is a situation where we have hospitals that rely on Medicare and Medicaid and then in private insurance and elective procedures that people have, all kinds of surgeries and procedures and so on. So in this crisis, there is now a national recommendation and a state requirement not to do elective procedures, not to bring people into the hospital to expose them in some way to the virus and be able to keep people safe. The problem is then the hospitals are in a situation where they don't have the ongoing revenue from that they need, which is why when we talk about more funds federally, it becomes absolutely critical. I mean, we've got to do both small business and the hospital and healthcare providers to make sure that we can make up for that lost effort and the resources coming in. And it is a challenge both for certainly our Metro Detroit hospitals as well as all around the state. And in some ways, it's an even more challenging issue in rural areas where they don't yet have, and we hope they won't get, but they don't yet have the incidence of the virus, but are not doing the elective surgeries. And so they are in a very tight situation as well. So more resources. We've got to make up for this and understand we've got to keep our hospitals going so that they can not only respond to the pandemic, but come out of this at the other end as strong medical centers.
Thank you both. Carolyn.
All right, thank you, Huel. You know, the healthcare industry is so very important, but so is the auto industry. Right now, we have GM and Ford working feverishly to transform their plants to build ventilators and that sort of thing. They're also trying to reopen their plants overseas. But what I want to ask you, Senator Peters, is this. Do you anticipate the need for another auto industry bailout? If so, would you support it?
Well, right now, we're not anticipating that. In fact, we're hearing from our auto companies they just need to have access to the capital markets. They need to have access to loans to get through this. But you're absolutely right. They are right now doing an incredible job about diversifying some of their production lines and producing critical medical equipment. I just think that's an incredible testament to the manufacturing power that we have here in Michigan. And when we think back to the days of World War II and the arsenal of democracy, when our auto industry transformed into providing war materials to help the Allies win the Second World War, we're kind of in a situation very similar to that, and we've got the ability to make things. We know how to do that very well here in Michigan. We've got great skilled labor and engineers. That now we've got General Motors and Ford, Chrysler all making masks, making ventilators. They've gotten into these processes, and they've actually worked with some of the ventilator companies, and just by them looking at their manufacturing process has been able to increase the production lines dramatically. And now they're starting to transform some of their plants to make this critical medical equipment. And that's going to be very important, particularly in making masks. We're seeing them make more and more personal protection equipment. We have shortages. We continue to have shortages in personal protection equipment and masks. We need to have those masks not just for our medical personnel, but in order to reopen the economy, we're going to have people that are safe and feel safe and have that kind of protective equipment. And they're going to need that protective equipment in those plants. Right now, I know the auto companies as well as manufacturers all across Michigan right now are thinking very hard and long and deeply about how they start production and make sure they're protecting their employees. And we can look at a number of models around the world. The Germans are moving pretty aggressively in this area. In fact, they're focusing on the auto industry because they understand how important that is to their national economy. But there are ways in which you can restructure the production lines to keep people separated, make sure they have personal protection equipment, have folks enter and exit the plant in different ways. There's a whole set of procedures that can be put in place to keep workers safe and also start production. And of course, the auto companies need to work very closely with the UAW to make sure that the UAW and the workers in the UAW feel comfortable going into those plants and starting production. But based on the work that they're doing, I hope that we'll be able to see that at some point in the near future. But again, it's about keeping people safe while also slowly but surely ramping up production.
Absolutely. Thank you, Senator Peters. Senator Stabenow, I want to ask you this. 43% of small business owners say they will have to close up shop within just 6 months without much needed help. Is it fair to keep all businesses shut down? I know the auto industry, they're trying to ramp back up. But what about the greenhouses and the lawn companies and the golf courses? Can any of these businesses operate safely with social distancing guidelines, or even pool companies now that summer is approaching? What are your thoughts on this?
Well, there's a lot of important questions, I think, that we all have. And given the fact that this virus is something that's new and is very contagious and we don't yet understand all of it, I think we have to rely on the medical professionals. And I know it's very frustrating because we can all look at individual situations where we think it would be okay, and yet at the same time, it's all connected. And so I think we've got to look at what the medical professionals are saying, and then to go back to testing. I mean, I want to just keep saying that the way we open things up, whether it's our automakers and the auto plants, and give a shout out to all of our auto workers who are involved in retooling all those plants for ventilators. But what we really need is to be able to have a quick test, saliva test, or a nasal swab, and when you are then going into work, you can take a test and feel confident you can go to work, and your employer can feel confident. That can happen if we have a national focus on testing. I mean, that's the way we safely open things up. And I want to give a shout out. Michigan State University just announced today that some of their researchers have a new test that they've been able to put together that may be able to work across different platforms and create a quicker way to be able to do some of this testing. But we've got to do that so we're not flying blind. I mean, we're all so frustrated, and we all know we want to get folks back to work, and we want to be able to get out of the house, and if we're in a situation as an essential worker, we don't want to keep having to walk into a situation and not know. And so to have that, we have to have information, and that means testing that can be done in a way that we feel confident that we can go to work, we can be out together, and know that we don't have the virus. And if somebody does have it, then we know they are the ones that should be staying home, not everybody.
You're so right about that. Thank you so much, Senator Stabenow. Devin, I'm going to send it over to you.
And I'm going to send it to Senator Peters here. Senator, this is a question that just keeps coming in, whether we're doing a town hall or not. This is a state issue, but you're the former director of the Michigan Lottery, and questions continue to come in as to whether the lottery is anything close to essential. The governor has kept that open while there's a zero tolerance policy seemingly on just about everything else.
Well, I guess I wouldn't call the lottery an essential business, but I would say it is an important business for the state of Michigan. There's no question that the revenues that the lottery generate does go into public education, and it does provide a very important function in providing resources for our public schools. But I would, as a former
we could say that about a lot of revenue streams, couldn't we? Right now, I mean, of course.
Well, that's true.
Yes.
Yeah, and I agree. I wouldn't call it essential. I'm saying it isn't a very important part of the state government, and the revenues are important. But if you're thinking about essential business for the health and safety and the welfare of folks, clearly that's not what it is.
Yeah, Senator, appreciate that. Let me move to Senator Stabenow now. We are starting to look at medical equipment and pharmaceuticals from a national security standpoint. As the ranking member of the Agriculture Committee, I want to talk about food as it relates to national security. Yes. There is ag money in the stimulus package. There were already billions of dollars going to farmers due to the trade war issues. But we're now looking at what could be a meat shortage, given what's happening in South Dakota. We're watching the price of eggs going up, alarming for a staple. So how do we protect our access to food given the massive entanglements of international trade when it comes to food?
You know, Devin, that's a really important question, and it's actually something I've been focused on for a long time, clamoring that a process that we have right now that reviews whether or not other countries can buy our companies. It's usually based on defense technology and so on, and I've been saying it should be based in part on food security as well. Because we have more and more of our companies, our processing companies, being bought. Smithfield Foods is about 40% of the pork processing operations, and they're now a Chinese company. And so I think this is a very serious issue for us. There's a couple of things. And by the way, that happens in manufacturing as well. When we are looking at what we need to do, whether it's on testing or other medical equipment or looking forward on how we're prepared in the future, we need things made in America. We need things made in America. We need things grown in America. And on the food supply end, we are now in a situation what is two things challenging. One, Our farmers have been hit every which way, by weather, by trade issues and so on, and now by this. And so I was able to get funding into this package that more specifically helps Michigan. In the past, fruits and vegetable growers were not the ones being helped. Our dairy farmers were not being helped. We know what's happened with Turkey and the country of Turkey and cherries, and we've had all kinds of things as a problem that have hit our farmers. But the new package has new relief for them. We need it to make sure it gets to them. But the second piece is because what's happened in the economy now, and we're seeing the stories now about food supplies and so on. We have a grocery store food system, and then we have a system for bulk purchase where we have aid producers that sell to McDonald's. We have people that sell to restaurants. They do all kinds of bulk kinds of purchasing. And that is in many ways just shutting down, which is very scary because they don't have any place to sell it. And so we're trying to figure out, the grocery stores are doing fine. The bulk purchasing is not, and we're trying to figure out how that can either transition or more donations. I don't want people, you know, milk producers dumping milk. I know the Michigan milk producers don't want that. It is heartbreaking to watch. So how do we transition that where the food can't get to the restaurant or fast food, that we get it to the food bank? And so I'm in the middle of those things right now, trying to figure out how we do that. And I know our food producers in Michigan care very much about wanting to help people in need right now.
Yeah. All right, Senator, let's get back to Huel.
Devin, thank you. Senator Peters, we all know that Detroit remains a hot spot for COVID-19, but it's also true in Chicago and New Orleans. And many viewers want to know what the federal government can do to reduce the disproportionate impact of this virus on the minority community.
It is stunning what we are seeing. There's no question there's a major impact on minority communities, African-American community in particular. What we're seeing here in southeast Michigan and Flint and other places across the state, that African-American community is hit much harder than any other community. And I think it tells us a number of things. One, it shows that we've got to make sure that we're providing health care into those communities. We've seen over the years, many folks have not been able to receive the type of health care that's necessary to deal with what we call now pre-existing conditions, or the kind of chronic diseases that also weaken the immune system, that make you particularly susceptible, it appears, based on the evidence, to this COVID-19 virus. If you have some of those conditions, heart disease, diabetes, other kinds of things, you're more likely to succumb to the disease. We've got to make sure we have the resources and investing in communities that have been underserved for far too long. You know, I'm a believer that everybody in this country, no matter who you are, no matter where you live, should have access to quality, affordable health care. We're not there yet. The Affordable Care Act was an important piece of legislation that expanded that access dramatically. In fact, if you look in the city of Detroit, for example, the uninsured rate was cut in half as a result of the Affordable Care Act. We need to continue to support it and strengthen that. One thing that I think we need to be looking at right now, for example, is to open up the enrollment for the Affordable Care Act. We are in a health care crisis of unimaginable proportions right now. And to me, it makes no sense that we are not opening up the enrollment for the Affordable Care Act to allow people to get in, to get affordable coverage, and to make sure that they have access to the health care they need, not just to get them through this crisis, but to make sure for future crisis and for the future health for them and for their families, that they have access to that kind of health care. This pandemic has exposed the inequities that we have in our society in a dramatic way. Not only folks that don't have the proper kinds of access to health care, but we also know folks who are essential workers who don't have the luxury of being able to stay at home and shelter at home, but they actually have to go to work to show up in order to get a paycheck. They are absolutely essential, and they live a different life than folks who can shelter in place. We have to be aware of that. We have to recognize that, and we have to understand that we have to prioritize it in ways we never have done before.
Meanwhile, Senator Stabenow, a viewer, Novi, is concerned about the Postal Service. She says that postal workers are not getting the protections they need, and she wonders if actually the Postal Service is getting enough support in Congress to survive. What would you tell her?
Well, I'm going to speak to that and then hand it on over to Senator Peters, who has been part of his responsibilities overseeing the Postal Service, and he's been a terrific champion on this. But let me just say, there's not enough of protective gear, but there's more coming in. We're pushing very hard. Senator Peters and I have been on with the Postmaster General pushing for workers in our centers and so on. And then secondly, we need a Postal Service, and they need not only funding, but unfortunately in the past they've been structured in a way where they have to pre-fund their retiree health care in a way that no other business or government has to do, which creates incredible financial pressure that is not fair to them, and that needs to be restructured. So, Senator Peters, this has been an area where he has been really a leader.
Well, Senator Peters, very quickly, if you would also like to respond.
Yeah, I appreciate that, Debbie, and it's right. We've got to make sure our postal workers have the protection that they need. We have a number of postal facilities right now where folks have tested positive. We've got to make sure that those folks have the opportunity to be isolated, and everybody else gets to be tested to make sure that they're healthy and to make sure folks have personal protection equipment. But the Postal Service is in a very precarious financial situation right now. In fact, I worked and negotiated a loan for the Postal Service in this CARES Act to keep them solvent. What we had heard from folks at the Postal Service is that they could have been insolvent as soon as September of this year. They're seeing postal volumes drop dramatically. In fact, in our conversation with the Postmaster General, revenues have dropped by more than 50%, which puts a significant strain on the service. They needed to have some bridge loans to get through this pandemic, but it's also clear that we're going to have to make sure that we're providing resources as well as working with restructuring of the Postal Service so that it continues to be vibrant. You know, I agree we have to have a Postal Service. It's absolutely critical for this country. It delivers valuable medicines and information to folks. And when you think about people who particularly rely on the Postal Service, it is in our rural communities. Many of the commercial services, they like to take packages into suburban areas or urban areas, but it's not as profitable for them to go into the rural areas. And our rural residents, that's their connection, is through the Postal Service. And we've got to make sure our rural residents in the state of Michigan continue to have a strong and vibrant Postal Service, just like every other person in the state of Michigan.
Carolyn?
Thank you, Hugh. Senator Stabenow, this question is for you. Tricia from Madison Heights wants to know this. What about our prisons? Someone very close to me is in prison and the coronavirus is there. Why weren't there preventative steps taken right away when this came out? We also did this on the news just last night. We know jail doctors and a commander have died at the Wayne County Jail. So please respond.
Well, Tricia, I really appreciate that question, and I have to tell you that this is very personal for me as well. Before the town hall tonight, I was on the phone with my niece, who's a clinical social worker in the Jackson prison where all the outbreak is. I'm not sure if that's the place that you're talking about, but and it's pretty scary. Both for the people who work there as well as the people in prison. And I also have a nephew who's a deputy sheriff in Ingham County and works at the jail. So, and I mean, I have other members in my family as well. It's very, I very much understand this. From my perspective, I've been a strong advocate to get the protective gear. There, as I understand it, the masks are now coming in and so on. It wasn't as fast as it should have been, but honestly, it's because we couldn't, as a state, we didn't have access to the PPE equipment, the protective equipment that was needed. I mean, all of our congressional delegation together on a bipartisan basis has been working with the governor and her great team to push in every way we can to get, and you've heard about all these things about the masks and the gowns and the gloves and everything else that's needed. And I can tell you it's really been hard to be able to the way it's set up is very chaotic, and so there wasn't enough equipment at the beginning, As I understand it, it's now coming into the system, and I wish there had been more available sooner. I know there's some other changes that are being made there to make things safer for folks who are in prison as well as the folks who work there. But this is one of the areas when we talk about folks going into high density areas, lots of people not protected as soon as they should have been. They are, in my opinion, ranked right up there at the top with our heroes, our new American heroes.
You're right about that. Thank you, Senator Stabenow. Senator Peters, this question is for you. You know, Michigan has been in the news. Detroit has been in the national news. Detroit Mayor Mike Duggan, he was speaking nationally this morning, and he was talking about the Avid Rapid 15-minute testing really being a game changer in the city of Detroit. I think he said he returned 700 officers to duty, and 200 ended up testing positive and then getting the medical care they needed. I mean, wouldn't it be great to have this available across the state of Michigan? We keep talking about testing, but it's right here in Detroit.
That's right. The Abbott test is in a lot of ways a game changer. The challenge right now is to scale it up. There are a number of other companies that are also working on a very quick type of test, and they need to continue to move forward with their efforts. I had a long discussion with folks from Abbott Labs about their technology, which basically uses the same system that you get tested if you go to your local physician and get tested for the flu or for strep throat. It's basically that same kind of system, but now adapted to test for COVID-19. Right now, Abbott Labs has the capacity to produce well over 50,000 tests a day. I think they're expected to be able to deliver hopefully close to 1 million of those tests a week very shortly. And in talking to the representatives from the company, they are now ramping up production. They're adding additional production lines. They think that they're going to be able to double that capacity fairly soon, and then within perhaps a month or two after that, double that again. So this is incredibly important because you have to be able to quick test folks. If you have somebody who tests positive, people who work in that workspace with those individuals, we need to know whether or not they're sick or not. They can get a very quick test and they can stay on the job. Certainly the mayor in Detroit has been using it very effectively to keep first responders and law enforcement on the job. We need to keep them healthy. They need to be on the job. They are clearly necessary folks for our society. And it is working well, but we need more of those tests. But you need to expand that, ramp it up. And there are, as I mentioned, a number of other companies that are doing it. So we get that throughout the private sector as well, so people feel comfortable in their workplace.
Thank you so much, Senator Peters. Devin, I'm going to send it over to you.
Yeah, I want to get now, Senators, to something that I got a lot of emails about that I don't think you would call a question. It's really boils down more to statements, and they are statements of frustration, and that's the way things are done in Washington. Spending bills are never simple affairs. They end up being Christmas trees that get decked out in all kinds of ornaments and tinsel. And important to point out that the original stimulus package did finally end up being unanimous in the Senate, but it ended up including things like money for the Kennedy Center, money for public broadcasting. I'm a huge fan of public broadcasting. I have no idea what it has to do with the virus. On the other side, there were carve-outs that took care of getting rid of some banking regulations. And my favorite in the whole thing, there was money for producers of innovative sunscreens. I guess this boils down to, why does this have to be the way that we get things done in Washington rather than addressing the problem that's in front of us? Senator Stabenow, let me let you take a whack at that first.
Well, this is a very large package, and you're right. I always have frustrations when we get done with something which we need to get done, and then there's things in there that you don't personally support. So it's always a big frustration. I think in our democracy, when we're trying to do something quickly and it's a very large package, there's always some things that you can point to. I will say this, that the big picture was helping businesses large and small, helping tackle the pandemic, helping our mayors, our cities, our states, and so on. And so the big pieces that really got done, they were the right things to do. And I just stay focused on that and know that there will always be a few things that I shake my head about.
Senator Peters, let me let you weigh in on this as well. I think it's those small pieces that drive people crazy when they talk about the system.
It should drive them crazy. It drives me crazy when I see those things in the bill, particularly when we're trying to deal with this immense crisis and come together, that you have folks that try to stick in and sometimes they're successful in sticking in these things that have no basis being there. You know, part of it is because of the rush of this legislation. It went through so rapidly that the kinds of checks and balances weren't fully in place. That's wrong. I hope when this next legislation we don't allow anything in there that's not directly related to dealing with the COVID-19 crisis. That's what we have to do. You know, I'm ranking member on Homeland Security and Government Affairs. I'm a ranking member of our top oversight committee in the Senate. And I worked with my Republican chair, and we were able to put in this legislation some oversight panels, empowering inspector generals, IGs, to make sure they're reviewing this entire plan to make sure taxpayer money is being spent wisely and the way it was intended, and to eliminate fraud and abuse. We did that on a bipartisan basis. We've got to make sure we're focused on that kind of accountability and oversight.
All right, Senator Peters, let's head back to Huell.
Hi, Devin, thank you. We've had at least 5 grocery store workers who have died from COVID-19. Some of those workers tell me that maybe it's time to start screening both workers and customers before they enter stores. Maybe taking temps now, maybe testing their blood later. But what about those results? If a coworker does test positive, what about privacy issues? Should an employer then tell other workers that an employee has tested positive? Senator Peters.
Huell, I'm sorry, I had a hard time hearing that question. I apologize.
I'll just put it frankly. Several grocery store workers have died from COVID-19. There are some of them who want testing to begin on both workers and customers. Maybe taking temps now, testing their blood later. But if the results come back positive, should the employer let the workers know? What about privacy issues? Just very quickly, what do you think about that?
Well, workers need to be protected. They need to be safe. You're talking about grocery workers who are in a situation where they don't feel safe. We've got to make sure that our workers on the front lines have the personal protection equipment that is critical to keep them safe, to keep the public safe. That's what's going to be necessary for us to start opening up these places of business. That's why testing needs to be more robust as well, so that we can keep people safe. That has to always be our first priority.
Senator Stabenow, let me ask you. What about testing of customers who come into stores and co-workers, and what about privacy issues regarding those results?
I think those are important questions, and I think we have to look at the reality of the situation we're in right now. Until we get a vaccine where we can feel confident that we are protected, we're in a situation where we all are better off if we know our own situation, and if we know that someone who is walking into a store or someone who is a worker that is able to be tested and they are COVID positive, then they should not be able to proceed with everyone else. And so I think it's much better to say to a worker, please go home, take care of yourself, and let everyone else work and have the confidence that they are safe, than it is to not know. So I think that's where we are right now, and that common sense would say if we have a chance to know if we're in a group whether or not 5 people have COVID or not, we'd sure want to know, and we'd prefer that they not be there.
Carolyn.
All right, thank you, Huell. Senator Peters, this question is for you, and this is a tough one to even ask, but we ask viewers for questions. A lot of people can't put food on the table, can't afford their mortgages. Jerry from Detroit wants to know, why are all of the politicians still collecting their nice salaries while so many of their constituents are not?
Well, I can certainly appreciate the frustration and folks who are in a situation where they're now unemployed and worried about the future. And I'll just say that's why we're working day and night to make sure that the resources are provided to men and women all across the state of Michigan. That's why I worked so aggressively to make sure we had a robust unemployment system, that folks could qualify for unemployment insurance, even those folks who in the past could never qualify, to make sure they got the money that they needed to keep food on the table and a roof over their head. That's why we're going to continue to fight to make sure our small businesses have the resources they need and keep their employees on the payroll. This is about fighting for everybody to make sure that they can continue to get the income that they need in order to provide for their families.
You're right about that. Thank you so much, Senator Peters. Devin, I'm going to send it over to you.
I think we've got time for just hopefully we'll hear one more question, and let's go to Senator Stabenow. I got a number of versions of this question, but a very succinct version of it just came in tonight since we've been talking on Twitter. What about relief for college students? I have two dependents. There's no relief for them as they're both over the age of 17. Both have lost their jobs. Both have had their internships canceled. Both moved home and now taking classes online. I guess as we try to figure out where the holes are in the safety net, is that a group that has kind of been left to fall of their own weight?
Yes, absolutely. And I would say Senator Peters and I have a bill that would make sure they could get the stimulus check. If someone's at home as a college student with their parents, they should be able to get the $500. Secondly, there is student loan deferments. You can defer up to, I believe it's in most cases, 6 months, your payments right now. But there's a lot more that needs to be done, and I'm hopeful that's done in the next package.
All right, Senator, let's, Huel, I think that just about wraps up our time for this evening, doesn't it?
I think so, and as is always the case, Devin, we've run out of time long before we've run out of questions. There were many of you who did not get a chance to ask a question this evening, but we thank all of you for sending in your questions, and we want to extend our deep thanks to both Senator Debbie Stabenow and Senator Gary Peters for spending the hour with us. Thank you both very much.
We also want to thank the many people at Fox 2 News, Local 4 News, and 7 Action News for pulling off what is a rather complicated five-way broadcast, as you just saw, especially given the social distancing that our producers and directors are trying to observe. But it has, again, been a pleasure to watch this unusual partnership come together, of course, so we can pass along the information that we all believe is so very critical as we battle this crisis together. Devin?
Well, I so agree with that, Carolyn. And here's hoping that we are drawing closer to the day when this kind of broadcast isn't necessary. Until we get there, though, we are so grateful to you, whether you've been watching tonight from Marquette, Alpena, Lexington, Battle Creek, Wyandotte, or Detroit. We remain mindful that we are together as Michiganders, and that goes for tonight and every single night. But yes, hopefully we will. And these two that are with me tonight are not only competitors on a usual basis, but also friends. And I know we all enjoyed partnering on this. So for Huel Perkins, Carolyn Clifford, and the three proud television stations that we all represent, I'm Devin Skillion. Stay safe and good night from Detroit.
And that is going to wrap up the town hall with Senators Debbie Stabenow and Gary Peters. Make sure you go to onedetroitpbs.org for our daily coverage. We'll have updates, interviews, and perspective on the COVID-19 crisis in Detroit and across our area. These are unsettling times, but thanks for trusting in Detroit Public Television to see you through it. For all of us at One Detroit, I'm Christy McDonald. Have a great night. We'll see you next time.